So, types of things you can measure, types of things that can be valued. What we tried to do, given that we were aiming this at non-economists and non-environmentalists and so on, was to look for sources where there are already measures that say, if you do this, you get a return of about this much money. And so I'm not going to go through that now, but the resource itself does include kind of links and other sources where you can go to get some monetary values to plug into the tool. So you can measure health improvements, you can value them, crime reductions. Those are the two areas where there's significant work for adding monetary value. You can also begin to identify reduced bureaucracy and waste, where have you kind of cut out internal systems and processes. Increased voluntary labour, you can value voluntary labour again, some dangers in doing that. And you can identify where you reduce duplication and so cut out costs. Now then, so what this tool is based on is the log frame, the logical framework. And so it takes you from what are you trying to do, how might you measure it, what are your possible indicators, can you measure them, what are the monetary values you can add to them, can you actually gather this information, how are you going to get it, and then finally, what are the assumptions that underlie that might kind of be to challenge you to think, have I got the right assumptions? So the example I use here is increased community use of a medical drop-in centre. So you have a community perhaps that doesn't trust or doesn't value that service, and you want to try and increase that, because what you want to get is fewer acute cases going to casualty. And the monetary measure of that will be, well, you can reduce casualty staff, and the costs of that hospital care can be quantified and reduced. How are you going to gather that data? Well, you can record the numbers of casualty admissions both before and after and during, and lengths of hospital stay and so on. And what that assumes is there's a direct relationship between preventative care and those acute admissions. Right, so it's a simple example. I'm sure you can think of better ones from your own work. And what we're trying to do, and this is now really not working at all, we're now going to really regret this. Sorry, this is going to take a very long time. In fact, I am going to come out of here. No, I'm not. So, what we developed is a simple tool. We weren't even supposed to be seeing this slide, but there you go. We developed a simple tool, which is basically an Excel spreadsheet where you can put in numbers. And what I'm trying to show on this slide is a representation of what this tool might show. So, at the kind of top left, it's showing you the costs of the engagement process, and you will know what those costs are. Staff costs, event costs, communication, participant costs, and other costs. And so, add all those costs up. At the same time, then you can begin to identify what the benefits are. They might be benefits in terms of new resources. I'm really, really pleased I kept pressing. Excellent. Okay. So, I'm going to keep talking and then I'm going to pull out of this and go back into that slide in a minute. There we go. Right. So, what the Excel tool does is it... in fact, I'm going to go to that slide there. So this is the tool asks you to measure the cost of engagement and the benefits of engagement, as you saw in that table, and then you add it up and you will find out whether you're going to gain more or lose more from that engagement process. And then the table also showed you the things that you might add in, so your staff costs and so on, and then what you gain. Now, one of the things the tool does is it says, and I think this is one of the mistakes that managers and politicians make, is they think you either do the engagement process or you don't. And they forget that just by having a town hall, you are engaging with the community. They forget that if they're going to make a service change, they're going to have to advertise it. They're going to have to hand out leaflets. They forget they're going to do something else, even if they don't spend money on going out and talking to and engaging the community. So what the tool does, which I think is an important part of the tool, is it says, what would you do if you didn't engage? What are the costs of doing that? What are the benefits you think you're going to do for doing that? And then you get that total cost. And then what it asks you to do is to compare the two and say, well, what are the benefits or costs of engaging versus what you would do anyway? What I'm not showing you is the kind of the Excel sheet that goes behind it, but that's the philosophy that lies behind the tool that we've developed. Now, unfortunately, Consumer Focus commissioned us to do this work a year ago. They're now being dissolved, and they won't publish the damn thing. So if you want it, we're allowed to kind of email it to people, but we're not allowed to put it on our website yet. And we're waiting for government to go through its kind of business of having spent money on us and not wanting to waste money, and finally to kind of publish the damn thing. So anyway, we have the report, and you now have a sense of what lies behind it, and if you want it, you can email it. Email me. So some tips for thinking about costs and benefits. First of all, focus on the most significant costs and benefits. Don't try and itemise every individual thing. You know, it's going to be roughly right and precisely wrong. Make sure you have something to compare it with. That's both the, you know, you're going to engage, or you may not engage, but you're going to be doing something anyway. The numbers by themselves won't convince without a strong story. Politicians in particular respond to a narrative, to a story. They don't respond just to numbers, unless they're Gordon Brown and they're slightly strange. Rough estimates are better than no evidence. One of the things we found when we first started this work back in 2004 is people in your position aren't capturing the costs. And you're not capturing the costs because you're scared of demonstrating how much it costs. But that's making your job harder to convince people higher up. You're hiding the costs in other budgets. Stop doing it. Cost it, itemise it, be honest with yourselves and with others, and actually it's going to be easier to make the case. And then don't overclaim on the strength of the evidence. Be honest again, because people, 5 minutes, so I'm going to be really quick. Okay, so the case against. I want to make quite a passionate case for engaging less. Often politicians start with, I want to do this, I want to have a consultation, it's important I do, and I want to get this outcome. And what they forget is why they're doing it. And we constantly make the case, you need to start with why you're doing it, where you're doing it, who you're doing it with, then and only then should you think about the process, and then you will get the outcome you want. And so trying to get politicians in particular to stop focusing on the process, the citizens' jury, the consultation, the webinar or whatever it is, and start thinking about why they're doing it. Secondly, and I'm going to scoot through this, we know very well the policy cycle, you go through the kind of political visioning all the way through to kind of deciding what the policy is and then implementing it. And we know very well what types of engagement process you do at different points in the cycle. I'm going through this quickly. I know that Zebra will forward the overhead to you if you want. I can see lots of people scribbling, so if you want the overhead, you can get it. So we know you kind of move through different types of engagement at different points. You do the visioning when you're at that kind of agenda setting stage, the kind of open thinking type stuff. And then as you move around, you narrow it down. You may well be much more into consultation, very narrow types. Nothing wrong with consultation if you're doing it for the right reasons. And then all the way through when you're at the implementation stage, when it really is kind of one way or two way. Small amounts of money on engaging the public on making micro decisions, as it were. I realise cutting a library isn't a micro decision. However, the case that I am making, and my slides really haven't worked at all on this computer, I'm very sorry, but this would cut apart, is rather than engaging the public on those smaller decisions, what we should be doing is combining all of that money and pulling up and thinking strategically about what do we want Southwark to look like. Where do we want to be in Southwark in 10, 20 years' time? For me, that's the empowerment agenda. It's not empowering people about those individual decisions about the libraries. It's about saying, where do we as a community want to be in 20 years' time? Where does the overall budget fit with this? And then engaging people and spending 100 grand on that, because you pull those pots together, rather than messing around with tiny bits of engagement. So when I say stop engaging, what I really mean is stop engaging on the small things and get people to pull up and engage on the big vision stuff. But then the politicians can work out the detail around, well, yes, we should still be cutting this library because we have agreed that we want to be here, and this is why I think this takes us towards our collective vision. Or no, we shouldn't be shutting this library, and we should be doing what's been done in the Southfield Centre, turning it into a community asset, and this is how we're going to do it. So that's where I want to be. Thank you all very much.
Thanks very much, Simon.